Welcome to today's IDS podcast. We're going to talk about a couple things today that may be a problem for you. Okay, so let's talk about, are you facing a situation where you're correcting staff all the time? You, doctor, are you micromanaging? Are you telling your staff what to do? I used to do that, didn't I?
Yes. You can't be a manager and a dentist both. It doesn't work.
Well, but she's doing something wrong. I gotta tell her.
No, actually you can do it. It's not that you can't do it. You actually can do it. But you can't do it and really enjoy your job. So when we hear this from dentists, it's not that they can't do it. Many of them do it. But when they get a hold of us to say, hey, can you help me with something? It's because they're not enjoying what they're doing anymore. So we're just looking for ways for you to enjoy what you do again. That's it.
All right, and so what she's trying to sell you on the idea is that she's better at doing it than we are. Or an office manager who's allowed to do her job does it better than I do. Now, it took me about 20 years to figure that out, but and maybe you don't have 20 years to figure that out, or maybe it'd be a good idea, particularly since many people watching this are at the beginning of their careers. Figure it out fast. You know, you got to have confidence in the person you're working with. I gotta tell you, I worked for a number of years with a pretend office manager, and then Danielle showed up and she convinced me that she was a real office manager, even though I didn't hire her to be that.
No.
She was my surgical assistant. So there is somebody in your office right now who has your back.
Mm-hmm.
You probably know who she is. You might think that she's too young. Oh, when you started, you were what, 28 when you started
27.
in the office? 27 in the
Yeah.
office. Okay. And when you became the office manager, when you were 30, 31, 30, something like that?
Yeah, early 30s.
All right. She could have done it when she was 28. I just didn't realize she could. There is that person. Now you say, well, she's too young.
No, I don't think so.
Yeah. I mean, if you're 18, maybe you're too young. 28? Nah, 28. You already had, what, 2 kids?
I honestly don't think that age is a determining
You think an
factor.
18-year-old can do it?
Sure.
Really?
We have someone in our office now that started when she was, 17?
Yeah, right.
She's, 22?
Something.
I think she could do it.
Yeah, she probably could.
Yes. It takes a certain person that can take emotions out of the situation, which the only reason why we're really talking about this, well, me anyways, is because I knew 2 doctors. I knew the old Dr. Sheldon and the new Dr. Sheldon. He loves when I say this. So
You saved me. Is that what you're saying? You saved me.
No, when I first started working here, you weren't exactly the happiest dentist on the block.
Oh, come on.
You weren't, were you?
Yeah.
He was not the happiest dentist on the block. As a matter of fact, we went through multiple, and I'm going to say multiple to be nice, staff members, because it was hard to keep them because doctors shouldn't get involved in emotions and drama and all that stuff. It makes you angry. That's not why
If I
you
hadn't
went to
gone
dental school.
through those staff members, I wouldn't have been able to hire you.
Oh, actually, okay. Good point there. But anyways, he's right. You probably have somebody in your office now that you can confide in, that you can kind of, I guess vent might be a good word, but you can say things to and trust them. And they always are the person that goes to try to make things right for you, whether it's the schedule or instruments not being correct, setups not being correct, schedule, patients being late, getting upset. You have somebody that you can kind of go to and they can make it better. Maybe they can make it a lot better. Maybe they can do better than what they're doing now because they're always next to you assisting. So it's finding that person that you can download to. So that's what we do. And that's actually how we got started.
Yeah, it is. And so downloading is important. You want to correct it right away. The instrument's in the wrong place, setup wasn't done, whatever the examples that Danielle gave. And the examples are also at the front desk as well. They're not doing what you want them to do. The problem is, as a doctor, you only have one perspective. You really do. You only have your perspective. And I got to tell you, of course, my perspective was always right. It's got to be. But I discovered that it wasn't always right, that there were other things that needed to be considered. Not that I wasn't right, But there are other things that need to be considered in order to be able to see all the moving parts, in order to be able to understand what needed to be done to correct the problem. Because for me to just say, you need this needs to be done here, I don't realize all of the other things that were going on in that person's existence at that particular point. Also, when I'm saying an instrument needs to be there and the instrument isn't there, well, is it the assistant's fault? Yeah, to some degree it is. But what if I never made a chart of all the instruments that I want for a particular procedure? The idea is that you want to create the system, and then the system does the thinking for you. You only have to think about the system once, and once the system's there, I do, all right, this is what I need. Make sure I have it.
Right.
And then you say whatever you say to me, and then...
Got it.
Got it. Yeah, got it is the typical thing she says. And then Danielle's job is then go to the individual staff members and find out, all right, is the system in place? Does the system need to be changed? If it needs to be changed, do we need a new checklist in order to be able to get everything set up the way I want it? Including the instruments that are there, even the order of the instruments are handed to me, because the more the routine is the routine, the easier it is for the assistant to be able to know, all right, he does this first, he does this second, he does this third, he does this fourth. Now, doctors, that also means that you have to start thinking in systems too. If you're doing the same procedure, you're doing a flap on number 2, 3, and 4, and you're using different instruments each time you do it, maybe there's some rethinking that you need to do as well. Part of systems thinking, I'm not saying, listen, if you need a 12B, you need a 12B, do what you need to do. But 90% of the time, at least, we do the same thing, step by step by step by step by step, and get it done. As a matter of fact, it's a good idea to do it that way just to see how good that system works for you and how fast you might go. And yeah, are you going to call an audible every once in a while? Or sometime you need a different instrument? You need a Goldman Fox? You need something like that? Yeah, sure. There is. All right, so you put that in there. But if we're working in routine systems, then the flap is open. You're doing the thing you need to do. You're degranulating. You're doing whatever you're doing to put the implant in, whatever that is. Order, step by step by step by step by step. It's done. And when that system is in place, you get done faster. Now, if the assistant isn't doing what I tell her to do, all right, that could be a training problem. Could be a problem. I mean, maybe it's the wrong assistant. Maybe you don't need that person. But if I'm able to tell Danielle, here's my problem. I got this, blah, 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 blah. And she says, let me look at it, and I'll get back to you. And she says, I got it. And when she says I got it, she really does. She's got it. It isn't like she's trying to put me off. Then she's got it. Then she's got it under control. She does her. What do? You do interviews? What do you do? What do you do with people when I say I don't like something?
It all depends. So it kind of goes back to your office manager does not have to be front desk type of person. As a matter of fact, it's probably best if your lead assistant that you have right now is probably the closest person you have to you in the practice, because you're with that person all day long. Sometimes that person is the best person to be the office manager because they're with you all the time. That's how we got started. So I actually became the office manager because when we're in the room, it started with his surgical needs, so he could stay on time, so he could successfully, do the surgery he wanted to do. So it was setup, it was anticipation, it was all the things he wants. So I was able to train our clinical team, to perform the way he needed us to perform to have the results he wanted to have. So I understand clinical. I am clinical, so that was easy for me to do, and it'd be easy for your lead assistant to do as well. So when he would say things like he was with a different assistant and he would start to feel like that maybe he's getting a little bit upset, he would call me in, tell Daniel to come in. And I would come in and he would say what it is he needed, or he would leave the room, come get me, say what he needed, how he wanted to say it, however he felt. I would say, okay, I got it. Go back in there and I'll work on it. And then I would work after that to either make a check sheet, update a check sheet, get with the staff, say, okay, this is the problem that we're having. This is what we're going to do to prevent that. So from now on, this is what we're going to do. So I did have it and I did fix it. Now, I would say got it also, so he would calm down and go back to work again. So sometimes what he said wasn't like exactly what we needed to do, and I knew that, but I'm not going to argue with him when he's already, just ready to, take someone's head off. So it's okay, got it, go back to work. And then afterwards, I don't always agree with him. Do I always agree with you?
No.
I hardly ever agree with him. But we
You
work
should.
together. We work together. I'm, in order to help him the best, I can't
Are there
always agree.
times that I'm wrong?
Maybe.
Yeah, you're right. Okay.
Sometimes.
There are times that I'm wrong.
But-
I really am. I mean, you think you're the doctor, you know everything. Get over it.
It's okay that your manager does say, maybe we should look at this differently. If we do it like that, this is going to start happening. So do you really want to change that? But I wait until he's, calmed down a little bit, and then
Understand, I'm creating drama. Is it better for me to create drama with somebody who can't fight back and can't
Good point.
do anything about it?
Good point.
So if I'm going to that assistant, blah, 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 and the assistant goes,
Emotional,
and
gets upset.
all right, so now you've not only micromanaged the assistant, because now you're saying you're correcting. All right. If you don't, again, we don't understand all the other things that entered into that, particularly we don't understand what system she's operating on. At least I can vent. My drama only goes to Danielle. The rest of the staff thinks I'm actually nice. And Danielle hears it. She says, I got it. She tells me to go back to work. She'll have the correction done. Often, I mean, within a day, the correction will be done. If it's a simple correction, it'll be done even faster than that. But she can be much more objective about it than they can. And because Danielle is there as the helper, we talk about help a lot. Danielle is the helper. She's helping me, and I know she's helping me. And the staff member knows that she's helping that staff member as well. Yeah. And so Danielle is the resource. Danielle isn't the boss. I mean, just because I'm yelling at Danielle doesn't mean Danielle doesn't. It goes back and yells at the staff member. If there's something dishonest going on, that's one thing. Yeah. But if we're talking about procedural things, and most of the things are procedural things that just aren't in place, or communication problems that just need to be ironed out, then Danielle's there to solve the problems, because the staff member wants to do better. Staff member doesn't want her head taken off.
Correct.
And I don't want to yell and scream.
Right. My job is to keep the tone high. When the tone is high in an office, your staff love to come to work. They talk great about you to their spouse, to their family, to their friends. Patients definitely notice this. They can feel the energy is good, and they always compliment how well the doctor works with his assistants and how it just feels so great and we're all having a good time. That's real. We're not acting. It's real. But I have to keep that tone high, and it's keeping the staff happy and it's keeping the doctor happy. Now, there's lots of people that have come in that's not a good fit, because you can't make everybody be like that. If somebody is a bad egg and they're not contributing to our energy here, they don't stay here. So we do have to, kind of sort through people to make sure that you have the right people. So you do have to look at your staff and say, is there somebody here that's bringing drama all the time? Someone here that's always a Debbie Downer, they're negative, they're never on board. Okay, get rid of them. Really get rid of them. I don't care how long they've been there. Get rid of them, because it's never going to get better. Get people that are high energy, willing, excited, and that will make you, the doctor, happier. It'll make things easier for you. And then have that recruited office manager to make sure that they're an advocate for you and your staff, and they can translate your concerns and your wants to them in a way like, oh yeah, sure, yeah, we can do this, and be excited to do it. So it's finding that person, because you can't correct your staff. No matter how you say it, they're going to come across, they're going to start crying, they're going to start looking for another job, they're going to tell their friends and family what a jerk you are. It just happens that way. You can't do it. Our staff loves him. They think he's so happy and so great all the time. He's just so sweet and nice. And that's great. He is with them. He really, really is with them, because he doesn't have to correct them. We don't want him to correct them, because it's not good for patients to see. It's not good for staff. It's not good. It's not good at all.
We were on the lecture circuit, and you would say this in front of an audience. I didn't know how to handle it. I'm sitting in the back, and you're saying all this stuff. All right, so now we're on a podcast doing the same thing. All right, so don't create drama, and don't have a staff member who likes to create drama either. If somebody thrives on drama, if they like to gossip, oh, for Pete's sake.
I don't care if you have to get rid of half your staff. Get rid of them now. There's lots of people looking for a job. There's good candidates out there now. Don't do it, because you're not gonna win.
Hey, you want to talk about that for a second, about Indeed, because you've been using Indeed lately with our clients and stuff like that. So,
Right.
yeah.
Yeah, Indeed has been my go-to for hiring, and I've 3 of our clients now. I went through hiring with them using Indeed as well. It's very simple. It's very easy. And it can be very affordable if you have someone running it correctly, and I can definitely help you with that. But Indeed is great because you can put your ad. We have a very customized ad that we put on there, drama-free, just really explaining what our practice is all about, not just a basic, we wanted a little system.
Yeah, by the way, remember, those of you who are my age and you had to pay by the word or by the line in your classified ad,
Yeah.
no, I mean, we're not doing that.
Yes.
When we're advertising in an online something, you're not paying by the word anymore.
Yes.
Make sure your creative writing is in and you're talking about the benefits of working in your
We
office.
do, and we explain fully, the high energy, positive, no negativity, no drama. We explain it fully in there. But with this, you can pay, they call it a sponsor. You pay a little bit of a higher fee, and you pay per application. However, you have 72 hours to reject that. So if it's not a good candidate, if they've job hopped too much, if they're not responding back to you, if they phone interview wrong, delete it. You don't get charged for it. So you only get charged for the applications, the resumes that you really, really like. So I like it because it's quick, it's easy. You can spend time on the phone. You can spend time like text communicating with them. So you can really find true candidates that way, and they're good. So I've had some really good luck with us as well as the other clients all over the
It's
country.
interesting. Danielle is hiring staff all over the country. Well, you never would even think about that, but she's doing that for our consulting clients, so it's kind of neat.
Yeah.
All right, so I work part-time. I work 2 days a week, and I see 9 new patients a day. That's all I do. So understand that that's the perspective I'm coming from, but when I was doing surgery, I was doing full treatment, I was doing 4 hours, maybe 5 hours of surgery in the morning, and I was seeing 3 or 4 new patients in the afternoon. Okay, did I ever intersperse them? Oh, I tried it. It was a silly way of going. It doesn't work. At least it didn't work for me, and I would challenge to whether it works for you. Because when you're in production mode, you're in production mode. And when you try to fit a patient in, a new patient who wants to spend $10,000, $20,000, $50,000 with you, you can't fit that kind of a patient in. You've got to be in receiving and in understanding and communication mode, which is far different from I'm trying to get the procedure done quickly, done well, and get and let the patient have a great experience. So it's 2 different things. So yeah, surgery in the morning, and for us, there are some who have an examination day, and they do it that way. Yeah. However it works, just make sure your dedicated time for examinations is the same as your dedicated time is for surgical treatment. But understand that dedicated time doesn't have to be this much. It can be this much. As long as I have an assistant who is willing and can do this much.
Correct.
I would much rather have the patient have a lot of confidence in the assistant than call me in as the senior consultant, because as soon as you have the doctor title, you're a senior consultant, then for me to have to handle everything from start to finish. So I can handle a new patient, and I'm talking about a complex new patient, in a half hour, maybe 45 minutes. In a complex new patient, maybe 45 minutes. But generally, we'll schedule patients for a half hour with me and a total of 2 hours with the treatment coordinator.
Correct.
And the treatment coordinator does everything, from taking x-rays at the beginning to assessing the x-rays to calling me to let me know what she sees on the x-rays and the discussion that she's had with the patient. And then I come in, I do my half-hour thing, I do my examination, the different possibilities, and then it's the assistant job for the next hour, and maybe longer than that, to explain the different possibilities and the different costs associated with it, and to get treatment acceptance done. Okay, the only way that can be done is if you have the confidence in and you train a treatment coordinator to do everything from x-rays all the way to treatment acceptance.
And that takes some time. I mean, we have some beautiful modules in our IDS library from everything from a complete new patient from start to finish, which shows me getting the patient, seeing the patient, getting them ready, getting all the data collection, briefing him, getting him in, doing the examination, getting the plan in, presenting it. So it's everything, which is about an hour and a half from start to finish. It's everything in there. So we have that in there, which is the basics. But what we try to show in there as well is anybody can do the basics. Anybody can see the patient. And just about anybody can do a full series of x-rays. They can do some pictures. They can do a CAT scan. Because I've gone to offices where this is done. These are trained professional dental assistants that do this, but they don't say a word. They seat the patient, they take the FMX, they take a picture, they take a CAT scan. They don't really say anything. They're not communicating. They're not building a relationship. They're not educating the patient. Your assistant can look at an FMX and know what you're going to say. They do. They know that. But you have to be okay with them talking. They're not diagnosing. They're talking about it. I mean, you can say what you see and what the doctor might be saying on it, but what you want your assistant to do is be able to get them primed and ready for what you might want to say, because you don't want them to just totally be shocked and then want to leave because they can't handle what you're telling them. And we see that a lot in our office. So, there is a lot of value that comes to your assistant not only being able to talk about this, having the knowledge to talk about this, and you having the confidence that they actually can do that, because patients really do appreciate that. They really appreciate all that information. They're there to let you know what they want, and you're there to tell them what they need, and then you guys come together to form these plans. But your assistant needs to be able to identify those.
Yep.
So he does a great job educating us on how he wants us to educate his patients, which is the reason why we have the acceptance we have.
Essentially, that means that you're asking the assistant to learn how to be a diagnostician and treatment planner. Even though do they make a diagnosis? To the patient, no, but certainly with the patient, they can, as they get more and more experience, and they have the responsibility for looking at the x-rays and the CT scan and understanding what's there, then it isn't just a matter of putting the sensor in the right place or position the patient in the CT scan jig correctly. The additional responsibility is to be able to discuss that, and when they discuss that, they have to look. When they have to look, they're going to make some observations. Now, will the observations always be right? No, of course not. They won't. But when they've made the observation, that means that they've invested themselves in the patient, in discussion with the patient, and have also looked at the x-rays, and they've learned something, maybe just as much, but they've learned something. Then I will look at the same x-ray and I'll make my comment. If the person is sharp, she will or he will assimilate that comment, and that will go into that data bank that may be useful for the next patient. Within a few months, if you invest that kind of confidence in that assistant, the assistant can make all the mistakes she wants. Nobody's expecting, the patient isn't expecting the assistant to say, well, you need a 5.2 millimeter implant there. That's not the idea. But she will start to get a feeling as to where you might do crown and bridge, where you might do implants, where you might do a regeneration procedure, non-surgical periodontal procedure, whatever it is. She'll be able to appreciate that. And she will even look farther than that, if you're willing to do it, to look at the restorative treatment. Many of the people here that are watching here are specialists, but they're restorative dentists here as well. Sure. No reason why the periodontist can't carry the entire thought process right through to restorative dentistry. Put an implant. How about an implant abutment and crown? How about what are we doing here in order to be able to increase the not just the longevity, but increase the cosmetics of the area? There are all sorts of things that you can do in that half-hour period of time. And what's going to happen is the assistant is going to pick up on that as well. And as the assistant does better, she has more confidence. Now, what happens if the assistant's wrong? The only thing you say is, here's what I would do, or here's the way I'm looking at it. And you can say that right in front of the patient. Patient loves it. Now the patient is getting some instruction at the same time and getting some orientation as to what we're thinking as doctors in order to be able to help them do the best job.
I might talk with the patient about a full set of dentures or implant-supported prosthetics, because I'm looking at the x-rays going, there's no way he could save these teeth. There's so much bone loss. And so I'm talking about implant options. So what's the wrong in him coming in going, you know what, Danielle, I think I can save these teeth. I think that we can actually do, use the periscope and save these teeth. That patient is ecstatic. That patient just went through, oh my gosh, I'm losing my teeth, to now we can save them. It's good. There's no wrong in that. People buy on emotions. They buy on emotions for everything. Your car, your furniture, your clothes, your shoes, your house, everything is bought on emotion, and knowledge is attractive. When your assistant is talking about different treatments or what causes stuff or what could cause stuff, and they're communicating and they're building these relationships, this trust, patients find that so attractive. They love that. And it's so much better than them just not saying anything and writing down notes and bringing a piece of paper to them. That's not what they're looking for. So for our patients, we're presenting plans $5,000, $50,000, $90,000. So we have to build that relationship, and they have to have that trust in us to show them that we are your advocate and we're here for you. So that's very important for your assistant to be able to feel they have the confidence to ask these questions, to say these things, to talk with you in front of the patient, and the patient sitting back going, wow, man, they're good, they're really good, and they say it all the time, which is pretty cool. But invest that with your assistants. And Dr. Sheldon's been every week at our staff meeting, he's showing us something different because we forget or we don't fully understand it. So everything from periodontal treatment to crown lengthening to when endo is needed, when we can save a tooth, when we can't, and that really builds our confidence on what we're talking about.
That's right. I forgot I'm giving those lectures. Am I?
Yes.
That was this section, wasn't it?
Yes.
Yeah. Okay. Yeah. So we're covering every single procedure today. It was periodontal procedure.
Yeah.
It was plaque and calculus and gingivitis and bone loss. And I was lecturing in front of the entire staff. Yeah, we did videos for the IDS as part of that. But we went in there and and I gave a step-by-step presentation. And so far we've done cracked teeth. We've done endodontic treatment or pulp capping because we do restorative dentistry in our office. But even if not,
it's knowledge.
It's a piece of knowledge that your staff member can have. And today we covered perio. And we'll cover every single basic. I get in front of the whiteboard and I just draw pictures and talk. And everybody.
The staff loves it. I think it boosts our morale because we feel like we're leaving and we know more. And then we come to work and it's like, oh, we know more now. We can talk about this stuff, and it just really adds that. It's not the same thing all the time. We're slowly increasing that little bit of knowledge, and it makes them feel good. And when they feel good, they talk more. They talk more, they sell more. So it does work out. And you don't have to spend this time with your staff if you don't have the time or the energy or the want, the desire. We've made that for you. It is in the library. Just pick out what you're looking for. And if you need something, we don't have it, we'll be more than happy to do it for you. We love doing that with our staff. We can create one, but it's just a way to come together and go, oh, okay, yeah, I understand that now. So now I can explain that to the patient, and they don't need you as much. How we started this. If your staff needs you less for stuff, you have more time, the treatment plan, and to do your surgeries and not spend that time going over the same stuff all the time.
And that's what we do. I mean, that's a weekly staff meeting. To us is imperative.
Yeah.
Now, are there times that we won't, meet with only part of the staff or something?
Sure.
Yeah, sure. But a weekly staff meeting allows us to put that time there in order to be able to get that education done. So that education is something you can do on the whiteboard, or if you want us, if you want to be a member, that's great too. Anything else we wanted to cover in today's session?
No, we could go all day long.
Yes, we
I think we're good.
All right, we'll see you again soon.
Thank you.
Bye.